Hey, welcome back again, viewers and subscribers. This moment, I'm going to be speaking to you on Sorrel, or scientifically called Hibiscus sabdarifa, belonging to the Malvaceae family. And owing to research, I have found a randomized controlled clinical trial that was done in 2019, right, showing that Sorrel or Hibiscus sabdarifa actually treats stage 1 pre-hypertension, right? And here's some food for thought. So hibiscus sabdarifa, hibiscus tea is an effective, natural, and safe option for managing stage 1 hypertension, also called sour tea, with studies suggesting its efficacy is comparable to some standard antihypertensive medications. Drinking 2 to 3 cups of hibiscus tea daily can significantly lower systolic and diastolic blood pressure, particularly in individuals with mild to moderate hypertension. So, studies show a significant reduction in systolic and diastolic pressure, with some results comparable to a starting dose of leading blood pressure drugs. Now here's the dosage. Effective consumption often involves 2 to 3 cups daily, or approximately 10 grams of dried calyces in water. So these are the calyces here, these red, crimson, colored magenta, right, colored pieces here you see of the plant, right, quite up close there, right. This one is that I planted just before Christmas there. It has been growing quite well. So the mechanism, the way it operates, is that it acts as a natural ACE inhibitor. That's angiotensin converting enzyme. If you're familiar with anatomy or physiology, if you had some medical background, like myself, who's a nurse, right, this is what helps to regulate blood pressure levels, right, owing to the kidneys, right, helping to relax blood vessels, and contains high levels of antioxidants, including anthocyanins, right? And those antioxidants, those anthocyanins are very important. Antioxidants in free the body or eliminating free radicals, right, which cause chronic diseases, right, and anthocyanins also, which help to regulate blood pressure, right? So it's considered a safe natural alternative with few side effects, although it should be monitored if on existing blood pressure medication, right? It is best used alongside lifestyle modifications like diet and exercise. So you can steep 1 to 2 teaspoons of dried calyxes in boiling water for 10 to 20 minutes to make a strong tart tea, right? It has a sour cranberry-like flavor, which can be balanced with honey, cinnamon, or ginger, right? Now, as always, you have to exercise caution, and please always consult your physician or doctor before utilizing any herbal medicines. So, those on blood pressure medication should consult a doctor, as the combined effects might lower blood pressure too much, right? So, I'm going to be speaking on the randomized control clinical trial study that I found here. Randomized control studies or trials are the gold standard of evidence-based practice. Scientific studies, best practice, right? So we not only want to be speaking of the traditional uses, but we want to be able to align them with scientific studies. In other words, it's not what you know, but what you can prove, right? Okay, so the study is entitled Effect of Hibiscus sabdarifa on Blood Pressure in Patients with Stage 1 Hypertension. All right, here's the extract. Using different drug regimens has been proven to have effective effects on lowering blood pressure, but the adverse effects of long-term usage such medications is evident. According to recent trend in using herbal and traditional medicines, researchers have been focused on evaluating the effect of different herbals on managing hypertension. The aim of the present study is the evaluation of the antihypertensive effect of one of those herbs, sour tea, Hibiscus sabdarifer, also called carcade in Egypt and Jamaica, in Hibiscus in Mexico. On stage 1 hypertension, patients with stage 1 hypertension who were diagnosed by cardiologists has been included in the present clinical trial after giving informed consent. The patients were divided into two groups. The control and case group received the same lifestyle and dietary advices for controlling blood pressure. The case group received 2 standard cups of sour tea every morning for 1 month. The blood pressure of both groups was documented at baseline and at the end of the study, and the results were analyzed using SPS software. A total of 46 patients participated in this study, and there was no significant difference in terms of age and body mass index between groups. There was a significant reduction in systolic blood pressure in both groups, right? But the mean reduction in systolic and diastolic blood pressure was significantly higher in the case group, right? Using age Hibiscus sabdarifa as sour tea 2 times a day can be effective in managing blood pressure in stage 1 hypertension, along with lifestyle and dietary modifications, right? Now, let me go to the results here. All right, so the results, a total of 46 participants, right, participated in this study. The mean age of study participants was 49.83 plus 3.38 years, right? Okay, so let's speak a bit about the discussions here. So the present clinical trial revealed that sour tea can be an effective medication for lowering blood pressure in individuals with stage 1 hypertension. The blood pressure was also decreased in control group after 1 month, which could be due to non-medical advice such as lowering weight, using DASH regimen, decreasing sodium and increasing potassium, as well as performing aerobic exercise. And potassium, as I stated in videos, is a vasodilator which helps to open the vessels, right? Sabdarifa has been studied in different clinical and experimental studies. The safety of sabdarifa tea and extracts have been stated in the literature. It's noteworthy to mention that this herbal medicine has been considered as an effective factor for reducing and uptaking free radicals, right? Same thing as I mentioned, which helps to prevent, right, you from encountering chronic diseases, right? Helps to promote cardiovascular health, right? Brain health and such, right? Furthermore, improving lipid profile is another therapeutic effect of sour tea, and there actually have studies have showed that it helps to decrease cholesterol levels, maintain healthy cholesterol levels, right? Anthocyanins of Hibiscus sabdarifa can inhibit low-density lipoprotein oxidation and therefore decrease the atherosclerotic process. Moreover, it has been shown that sabdarifa has a compound that causes nitric oxide release from vascular endothelium, which follows by kidney filtration increase, a mechanism that clears its diuretic effects, so on blood pressure. Right, as I said before, Hibiscus sabdarifa actually has been proven to be a diuretic, right, like B-side, right, which helps to control your blood pressure, right. Now, different therapeutic doses have been reported for achieving the beneficial effect of sour tea, right. Furthermore, the recent meta-analysis about this tea has demonstrated that sabdarifa have significant effect on lowering both systolic and diastolic blood pressure. Moreover, the sour tea has also antihypertensive effect on diabetic patients with mild hypertension. A recent study from our country, Iran, has reported the effective effect of sour tea on lowering blood pressure in a 100 mildly hypertensive diabetic patients. Right? And the conclusion, using antihypertensive chemical medication has its own side effects and limitations. However, using herbal medicine could be a considerable choice with lesser adverse effects if used within appropriate amounts. In our population, positive beliefs about the herbal medicine among people make them more eager to trust and use herbal medication. According to the current study results, consumption of sour tea could effectively lower blood pressure in patients with stage 1 hypertension. Thus, concerning this herb as a medicine for hypertensive people seems beneficial. And it goes on to say, concluding, however, further investigation is needed to clear its mechanisms and effectiveness details in longer follow-ups. And I'll be posting this link in the video so you can actually read the study for yourself and find other studies. Also, I've also found that they're saying that Chinese herbal medicines, along with garlic, along with green tea and black tea, has proven from studies to actually be used to control high blood pressure traditionally, right? So yeah, so that's it for this one, right? Sorry if our video is too long, right? So thanks again, right?